Welcome to Understanding the Different Types of Medicaid, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health needs, as well as the professionals who serve them. We provide one-on-one peer support, information, education, training, and outreach. The information in this video is current as of May 2026. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your family's respective situation. The types of Medicaid discussed in this video are Hoosier Healthwise, Healthy Indiana Plan, Hoosier Care Connect, and Traditional Medicaid. Medicaid eligibility is determined by several factors and can be complicated. There are several different Medicaid programs, each with slightly different eligibility requirements, so please review all of the eligibility information. While different Medicaid programs have different eligibility criteria, the four main things used to determine eligibility are income and family size, age, resources and assets, and medical needs. Covering Kids and Families of Indiana is a free resource that can help you look at the options, determine what you may be eligible for, and help you apply. Hoosier Healthwise is for children up to age 19 whose families meet specific income levels. This could include current and former foster children, pregnant women covering early pregnancy through 12 months postpartum, as well as newborn coverage for up to 1 year for families who meet specific income level thresholds. Hoosier Healthwise Package A is a full-service plan for children and pregnant women. Members do not have any cost-sharing obligations, and eligibility includes an income of up to 158% of the federal poverty level for children and up to 208% of the federal poverty level for pregnant women. Hoosier Healthwise Package C, or CHIP, is a full-service insurance plan for children up to age 19 whose families have slightly higher incomes and do not qualify for Package A. Children on Package C cannot be eligible for employer-sponsored health insurance or other minimal essential health coverages. With this insurance package, members are required to pay a low-cost monthly premium as well as low-cost co-payments for certain services. The premiums and co-pays are based on the family's income, and when determined to be eligible for these packages, individuals will select a managed care health plan. The current managed health organizations for these plans are Anthem, CareSource, and Managed Health Services, or MHS. It's important to understand the managed care options and to talk to your current providers to ensure they are in a managed care entity's network. Also, the federal poverty level may change from 1 year to the next, so it's important to be aware of these changes as they're announced, as this can impact your eligibility. Healthy Indiana plans, or HIP plans, are for adults ages 19 to 64 who meet specific income levels. It's important for parents and caregivers to take care of their personal health, and while they may not qualify for the same coverage as their children, there are options for adults. The income eligibility requirements for 2026 include an annual income for individuals up to $22,026. Couples with an annual income of up to $29,870.40, and for a family of 4, an annual income of $45,546. HIP may also offer vision and dental, and members may receive incentives for taking better care of their health. The initial plan selection for all members is HIP Plus, which offers comprehensive benefits including vision, dental, and chiropractic services. The member pays an affordable monthly Power Account contribution based on their income. There is no co-payment required for receiving services, with the only exception being using the emergency room when there is no true emergency. HIP Basic is the fallback option for members with a household income less than or equal to 100% of the federal poverty level who don't make their Power Account contributions. Their benefits are then reduced. The essential health benefits are covered, but not vision or dental services. The member is also required to make a co-payment each time he or she receives a healthcare service, such as going to the doctor, filling a prescription, or staying in the hospital. These payments may range from $4 to $8 per doctor visit or prescription filled, or maybe as high as $75 per hospital stay. HIP Basic can end up being much more expensive than HIP Plus. The Healthy Indiana plan covers maternity care, but there are several things pregnant women need to know. It's best that these members talk with their doctors and healthcare providers, as well as their health plan providers, as soon as they become pregnant. These resources can help members better understand their maternity benefits. Hoosier Care Connect is a healthcare program for individuals aged 65 and older who may be blind, have a disability, or who are also not eligible for Medicare. This could include individuals receiving supplemental security income or individuals enrolled through the MedWorks program. Individuals receiving Hoosier Care Connect must select a managed care health plan. Traditional Medicaid, also called fee-for-service, provides full health care coverage to individuals with low income. This includes, but is not limited to, individuals who are under the age of 60, eligible for a home and community-based services waiver program other than the Indiana Pathways for Aging waiver, individuals under the age of 60 who are eligible for both Medicare and Medicaid, anyone under the age of 60 residing in a nursing facility, or persons of any age residing in an intermediate care facility for individuals with intellectual disability or other non-nursing facility institutions. Each local division of Family Resources or DFR office and enrollment center accept applications for all of the programs we've discussed. To find your local office, call the DFR toll-free number at 1-800-403-0864. The MCH Moms Helpline at 1-844-624-6667, or go to the websites listed below. To apply for Medicaid or Hoosier Healthwise, call the DFR toll-free number at 1-800-403-0864, or again visit the website provided on screen. Some medical providers may assist with Medicaid applications, specifically for those who may qualify for presumptive eligibility or institutional deeming. Presumptive eligibility is a process that offers short-term coverage of healthcare services for those with limited incomes not currently receiving Medicaid. The goal of presumptive eligibility is to make sure that those who appear eligible based on basic information have immediate access to healthcare. Short-term coverage will end if you do not complete an Indiana application for health coverage or are found to be ineligible based upon your full application. Institutional deeming eligibility is determined based on a child's medical condition and length of stay in a hospital. For children under the age of 18 or ages 18 to 21 and still in school, family income is not considered. It's very important that the applications must be completed while the child is in the hospital. For more information, check out the institutional deeming resources on our website at www.inf2f.org. Information required to apply for any coverage should be ready at the time of application. The information needed is for everyone in your household, and you will need to know the names, dates of birth, social security numbers, income from jobs or training, current benefits or those received in the past such as supplemental security income or SSI, Social Security Disability Insurance or SSDI, veterans benefits, or child support. Family and tax relationship information will also be needed. If you are aged, blind, disabled, or receiving Medicare, the amount of money in your checking accounts, savings accounts, or other resources you own, as well as any payments for adult or child health coverage and medical benefits that you or your family currently have, will also need to be provided. When choosing providers, please remember that doctors, hospitals, and other healthcare providers have the option to participate and provide services under many different insurance programs, including Medicaid. If you have a provider that you'd like to keep, be sure to ask them what types of Medicaid they accept, which managed care health plans they accept, and whether or not they are accepting new Medicaid patients. Indiana Family to Family does not provide health insurance navigation services, and we don't endorse any specific providers. We can, however, provide one-on-one peer support to help you understand all of your options, as well as help you connect with resources that may offer direct assistance with health insurance. You can connect with us for peer support by filling out the form on the Connect page of our website, inf2f.org, calling 844-323-4636, or by sending us an email to info@inf2f.org.